Okay, folks, why don't we go ahead and have a seat? We're going to go ahead and get started with our second panel. This next panel is going to be, we're going to kind of teach you a foreign language here for physicians. This is not information we're used to hearing, and this was really eye-opening for me to learn this information as I went along. You know, we understand medicine, but we don't really speak in the language of insurances and self-funded and level-funded, and these were all group captives and all this information that I had to kind of learn as we put this together. But I think as we become, embracing the market, we're having to understand how the market works, and when so much of what healthcare provision is through employers, it's really important to understand how that system works and how we can actually access and engage that. These fine folks here are with the Free Market Medical Association, and I'm going to introduce our moderator, Meg Friedman. Meg Friedman is from Oklahoma, and she's here to join us, and she can introduce our panel.
Good morning, everybody. It is awesome to see so many of you here. How many FMA members are here? Quite a few? Woo! Yeah. The Free Market Medical Association was founded by Dr. Keith Smith and Jay Kempton about 4 years ago with the goal of connecting the buyers of healthcare, which are the patients and the employers, with the sellers of healthcare, which are you guys. We are in our 4th year, have over 300 members, 17 local chapters, and we have folks in over 33 states. So we are growing, and it is great, and we are partnered with the Docs for Patient Care Foundation, and we work together to connect those people. I'm not going to read everybody's full bio this morning, but I wanted to point out that Jay Kempton is the co-founder of the Free Market Medical Association. Dr. Lee Gross, a great partner of FMMA, and also the 2017 Free Market Beacon Award winner, which is given out every year to those that show outstanding support and are really, really involved in the free market movement and pushing it forward. Chris Markford is the leader of the Florida chapter of the Free Market Medical Association. So without further ado, Chris.
Thank you very much. I think they asked me here just because I didn't have to travel as far as other people, since we're already here in beautiful Florida. So welcome here to our great state. While I do help lead with the Florida chapter of the Free Market Medical Association, my day job is as an administrator of orthopedic surgery centers, or ambulatory surgery centers specifically throughout the state. So I'm very involved with that at a state level. That's my love. That's really my passion. So today I'm going to talk to you about how these free market principles work within my realm of work, which is surgery centers, and how I believe that it is the source of the best solution for a lot of the problems that we're facing in healthcare. And I don't think it's any surprise that we see and we know that there are so many different problems out there, and every day there's talking heads on TV talking about how they have the answers to fix a lot of these problems. And I don't think those solutions are going to come from some legislation or from somebody up in Washington fixing these issues that we're facing, mainly because their focus has been so much on the access to care. How many times have we heard people get on TV and talk about how if only we opened up the state lines that you could buy insurance across lines, and if we can provide more access and we can lower premiums and create kind of this competition. That is not at the heart of the problem. Our problem, its source comes down to the cost of care. And that's going to be fixed by entrepreneurs and the people in this room, you and I. And each of us we came to this understanding that this was the right solution. You know, we didn't just wake up one day and say, oh, this is the best solution. A lot of us came to this understanding through personal experiences that we had. That you experienced something or witnessed something in your practice and said that this is not working. This status quo that we currently have is not the solution. For me, a lot of it came from a personal experience and as well as from a professional experience that I'm having within our own industry. Personally, My wife and I, we had one of these $99, insurance plans, insurance premium plans. We had a $10,000 deductible. It was there to cover us just in case of a major emergency. But we were also young and married, so I guess you could say we were at high risk for pregnancy. Thanks be to God, we got pregnant. We had a wonderful son named Jameson, and in about the third or fourth month of his pregnancy, we were there with the ultrasound technician. She called in somebody else into the room. That person looked at the screen for a few minutes and told us that our son would most likely have a cleft palate and or lip. So, it was a bit of a surprise for us. It wasn't too big of a deal. He, perfectly happy and healthy. There he is, a future free market doctor in the making with his little brother. So he's perfectly fine. But what wasn't fine was that the insurance company, whose name rhymes with True Loss. I don't want to point out the insurance companies that did this, but they dropped us. They said we were no longer covered under the maternity rider that we had in place to cover the cost of any potential pregnancy. So now all of a sudden, instead of having coverage through this maternity rider that we were paying for, they said that our pregnancy was now high risk, which is wrong on so many levels, but that was a decision they made, and now we were left in the position of having to fight for every dollar that we're spending. That tech who came into the room to share that news with us was a $500 bill. The entire experience now from a customer point of view really became a nightmare, having to fight and be passed around to different representatives through the hospital systems and through our insurance provider. You would think they were just trying to get us to the point where we would give up because it just became so frustrating. I did not mind giving up because I work in healthcare, so I knew the games that were being played, and I was able to utilize that knowledge to help me through this problem. But most people don't have that knowledge. Most people walk into these situations nervous, confused, scared, worried about how they're going to pay their bills. Now, professionally, I was seeing something happen in the industry that was also of grave concern for me. There are about 450 surgery centers in the state of Florida, and most of them are great, great places of care who are trying to do the best thing they can to serve the community that they're taking care of. But out of all those surgery centers, I would guess to say there's maybe about 25 out there that are some bad apples. And unfortunately, I have about 3 of them right in my backyard. They're my direct competition. And I'm not just going to badmouth them because they're my competition, but what they're essentially doing is you have these patients who are coming in to their specialist who's in-network, and that in-network specialist has ownership in an out-of-network surgery center. And the patient goes to this out-of-network surgery center, and the charges related to the care they're receiving are just astronomical, just crazy amounts. We had this one administrator who was bragging to me that they got paid for just the facility fee for a total knee replacement. They were paid $75,000 just for that one episode of care. And she was proud of this. And we wonder why insurance premiums keep going up and why the cost of care keeps going up, because again, the problem isn't access to care. The problem is the cost of care and not getting it under control. Now, this is a great temptation to the doctors who have ownership in these facilities because they see money being printed. They see a lot of money to be made. These facilities are giving out distribution checks of around $250,000 a month. So that's something that's hard to ignore when you're trying to, pay off your expensive, education. When you have bills to pay and kids that you got to send to school. So my doctors were hearing from their partners in the halls of the hospital and the halls of their practice about, the new boat they're buying and the fancy cars they were getting, and they wanted a piece of that action too. So they came to me saying, we want to do this as well. But I knew morally, ethically, this was not something that I can follow, that this was not what was good for healthcare. So we had to find a different solution. And thankfully, around this same time, I came across an article in Outpatient Surgery magazine about this wild card, this rebel out in Oklahoma, who decided to have the audacity to put all of his pricing for all of his surgical procedures up on his website. And this, of course, was Dr. Smith out in Oklahoma City. And it was inspiring to me, and it was something that I could get behind and something that would, I can be proud of, that I can sleep at night. If we were engaging this sort of behavior at our facility, this was the right course of action. And I was able to get my physicians to recognize, I was able to get my board to see that this was the way that we can improve healthcare in our community and take care of our patients. This would allow us to treat patients in the light instead of these other facilities who succeed and profit by keeping everything in the dark. That is their model, and that we were going to do something different, and it was going to be the right thing to do, and it was going to be the ethical thing to do, and something that we can be proud of. So we were looking at this, and we were learning more about what Jay Kempton and Dr. Smith were doing, and they founded the Free Market Medical Association, and we quickly got involved and found it as a great resource to be able to help us build up our program. And in learning about their ideals and their principles, you quickly began to see that the status quo, what we've always begun to accept as just the regular course of business, wasn't what was going to work. That the status quo that we had was not following these free market principles that we all learned back when we were in high school and taking our basic economics classes. Now, I know for a lot of you, it might have been a while since you were in high school, so we'll have a little, go back in time, a little lesson here. When we're talking free market, what we're talking about is when you have that willing buyer who's working with a willing seller to come to agreed upon exchange for goods and services. And we have a lot of doctors in this room. If I came to you and said, listen, doc, I got this rash on my arm, but I don't have any money, so how about I detail, clean your car? Will that be good enough for you to spend some time to take a look at it? And if you agree to that, you and I have entered into an arrangement that is the free market at work. You and I working together, agreeing upon a mutually agreed upon price for the services that you're offering. That's the beauty of it. That's the simplicity of it. Now, there are facilitators out there who can be a part of this process, and this can be good if they are supporting that basic principle of the free market. The credit card companies are essentially facilitators. They are not needed for the transaction of cold hard cash to the work that you're doing, but they help make that process easier. Yelp is another facilitator. I use Yelp all the time. In fact, I use a lot of these, all these companies that you see up on there. I use them all the time. If I want to go to a restaurant, I'm looking at the pricing on menus. I look at pictures of the places to say, is this where I want to spend my hard-earned money? That Rate My Professor, that saved me a lot of trouble when I was in college. So we use these tools, these resources to help us as consumers make informed decisions. So the Free Market Medical Association has been able to step in as a facilitator as well, to provide resources to help us as sellers of goods and to be able to help the buyers of goods make these informed decisions. But like any organization, whether it be an organized religion or a Fortune 500 company or an association, there are certain guiding principles, certain tenets that we need to strive to live by, that we got to have this solid foundation in the work that we do. And in the FMA, it's no different. In the Free Market Medical Association, we look to these pillars as kind of our guiding path in the work we're doing. And we're talking about price, equality, and value. So in starting with price, if we're to look at that, when I first started doing this with my surgery center in Clearwater, I looked at the different facilities throughout the country that were already doing this. And this map represents the facilities I was able to find. And I looked to them as kind of a great starting point for how we were going to determine what prices we were going to set in Clearwater. So these represent the prices of these different facilities, from my facility as well. And these were going to be all-inclusive rates. That we wanted a rate that represented the total cost of care. So that way when the patient comes in and when the patient leaves, the price isn't different. That they're not going to walk away with a surprise bill. That they know exactly what they're getting when they show up. I think since then, Dr. Smith has probably lowered his prices. So he's been very good and aggressive about, keeping those prices good, low, and fair. But at the time, these are the prices that we were going to put out there, and this is how we were going to introduce ourselves to that free market. And the point of this is to make the point that these prices, that you're not getting these prices by buying into a club. You don't have to have some sort of membership or pay a fee to have access to these prices, that these prices were going to be for all. And unfortunately, what we've had in healthcare is what we've been selling is access to prices. That's what the insurance companies are offering. That they're saying, you partner with us, you work with me, and I will get you these great deals that really aren't so great. But I will get you these percentage discounts. I will get you these discounts at these facilities. That if you work with us, that's selling access to care. That's not selling true health care. And in a free market, you don't sell access to prices. Because that has allowed a manipulation of the industry. that you have insurance companies who are able to work with certain healthcare systems to manipulate those prices to their benefit. That you shouldn't be surprised that there are healthcare systems out there, hospital systems, who will work with insurance companies to squeeze out the competition. That those insurance companies won't contract with you unless you are part of that healthcare system and an employee of that network. That you as a doctor, because you're not part of this hospital system, we're not going to contract with you. That's a manipulation of the healthcare market, and that drives up cost because those hospital systems really aren't so cheap. Because at the end of the day, when the insurance companies are proud to come in and say, listen, we were able to lower our percentage of charges from 60% of charges to 50% of charges, sounds like a great victory. All the hospital has to do is turn around and up their charge master to make up the difference. And that's exactly what happens. So there really is no true savings happening with that model. And the consumer isn't a part of that decision-making process. My patients don't realize it, but when I see a patient walk into our facility with a Humana insurance card, I know right away that that patient just saved about half the price of what they would have paid if they walked in with an Aetna insurance card, because I get paid differently from Aetna. Now, I'm contractually not allowed to tell you what Aetna pays me for the services I do. Again, it's all about keeping those prices secret, keeping it out of the hands of the consumer and the end user so that way they can't make that informed decision. But we're talking price, we're talking about putting it out there for everybody to see and treating everybody equal. And the surgery centers in this country have recognized this, that they can cut out the middleman, that they can cut out the insurance companies, that they can cut out the hospital systems who are manipulating these markets. And this has been, just in the past few years, these are now surgery centers throughout the country who are now utilizing this plan and utilizing this model. And the thing that I recognize as kind of a real beautiful thing is that this, this rate of growth that we're seeing with surgery centers embracing this model reflects the same rate of growth that we saw back in the 70s and 80s with the introduction of ambulatory surgery centers to the marketplace. So I really believe that 5-10 years from now, that this is going to be the new model, that this is going to become the new normal in ambulatory surgery center settings of care, which is a great thing for us as surgery center administrators and is a great thing for the communities that we serve and for the patients that we're treating. And when we're treating these patients, we're treating them all equal. So this brings us to equality. That when the price is out there, it's out there for everybody. This is an example of our website. A patient can go on there. Anybody can go on there. They can look at our prices. It's kind of the straightforward model. The click on the body, find the body part you want to have fixed, and there's your prices. But it's equal to all. The guiding principle that cash is king, that your dollar is no better than his dollar, that you can't come in and in buying this access to care, that you expect me to give you a discount because of the bodies that you can bring to me. And this is a great temptation for an administrator, because for me, it's all about increasing that volume. How do I get more people? And so it's that forbidden fruit. It's very tempting to do. And I'll be honest, I had a TPA that I had met in Oklahoma at a Free Market Medical Association conference. We struck up a conversation, great relationship. We went back home, began a way to partner together, and they had the audacity to say to me, we have about 100,000 lives in your market. How would you feel about giving us a discount to those prices because we can promise you care? I wanted to reach through the phone and smack the guy because I said, you were just in Oklahoma with me. You heard Jay, you heard Dr. Smith say that everyone gets treated equal, that cash is king, that you do not give discounts based upon the volume that you're being promised, because that is not the free market at work. In a free market, everyone is treated equal. And if they have a problem with those prices, they are more than welcome to go somewhere else. And it's up to me as a business owner to change my prices to reflect my marketplace. But that's my decision to make. It's not yours. So in a free market, everybody is equal. Again, we're putting up our prices for people to see. And the great thing that what FMMA has done is they've been able to step in as an added facilitator for me, not just to be able to put my prices out, but they work with surgery centers and facilities throughout the country. This is from the FMMA website. And you can see all the prices up there. I went in and I put in a CPT code 29881, which is a knee arthroscopy. And these are the prices that popped up. Thankfully, I'm not the most expensive up there. I'm also not the cheapest. But I'm also in Clearwater, Florida. we don't just talk medical tourism in Clearwater, we talk medical vacations. I can walk to the water, we're minutes away from the beach, so there's an extra value to what it is that we're offering. Brings us to value. So now when we're talking value, this is a tough thing to define for some people because it can be so subjective. It can be different for each patient. We know that healthcare itself is very much local. So what's important for one community might be different for another community. Maybe what's important to you is that you have that 5-star rating on Yelp. Maybe it's that every employee smiles to you and asks you if you had a good day. Maybe you have the latest and greatest technology that you come in and you're getting your knee replaced by a robot. Everybody has a different way to express what's important to them and the value that they had. And a lot of that's just building up reputation in your community. We all know, when we look at the Surgery Center of Oklahoma, that not only are their prices fair, but Dr. Smith has built up a reputation in the healthcare marketplace as a great value, a great place of care, where the patient feels that what they're paying is reflective of the value that they're receiving. And this is important because I think we a lot of times forget that from a patient perspective, a lot of our patients are living paycheck to paycheck. We may not be the 1% in this room, but I looked at the speaking schedule. I'm maybe one of 3 people that doesn't have MD at the end of my name. We've got to at least be in the top 5%, in this room. But the majority of people out there are struggling to get by, or worrying about paying their electric bill or paying their health bill. And so when they're making a decision and they're looking at their cost of care, they want to know that what they're getting is fair for the price that they're paying, that they're getting value for what they're paying. And so we got to make sure that we're sharing that with them and expressing that to them when they come in. And they're willing to pay more for higher value. If we can show them that we're giving them a better product at a fair price, the customer will come and they will pay more. And each of us will have these niche markets. Maybe you charge a lot more for what you're doing and your volume may not be as high, but that's the way the free market is supposed to work. My wife's got this crazy little side business that she does when she's home. She's making these little wooden dolls. I don't know why people buy them, but people seem to be buying them. She paints them, and she enjoys doing it. She makes little saints and book characters and all sorts of fun little things. And at some point, her demand on her time is getting to the point where she can't keep up. There's not enough hours in the day for her to make enough of these little wood peg dolls to keep up with her demand. So I told her, well, why don't you raise your price? Match up with the market of what's being demanded of you from the consumer. And so now each of us in a free market gets to make those same decisions. That our price will be reflective of what our customer is willing to pay. And they will tell us if they're willing to pay it by their feet, by their traffic, if they're willing to come in. And so we have to be able to work together to share that value with the patients. And a lot of that for me as an administrator of surgery centers comes down to a relationship with you as a direct primary care physician. That you have a unique relationship with these patients that you see throughout the year, that they have your cell phone number, that they're texting you, at 8 o'clock at night. You have a relationship with them that you want to protect. And if you knew that you can work, if you need to send your patient up to a higher level of care, if they have a wrist fracture and you need to send them for surgery somewhere, I'm sure you want to make sure that you're sending them to a place that's going to give them the value that they expect, the same value that you've been giving them throughout all the care that they've been receiving. So it's good for me to be able to work directly with you, so that way you know that when you hand off your patients to my doctors, that they're getting that same level of treatment that they expect. Now, in you driving those customers to me, that's beneficial for me. I like that. We want that. We want to build and foster those relationships. And the FMMA has helped to do that. We meet annually in August out in Oklahoma, although I hear we might be changing that venue. But it's beautiful because, I do a lot of ASC conferences. I'm in a room with a lot of surgery center administrators and a lot of surgeons, in the same way you're here with a lot of DPC doctors. But the beautiful thing about these meetings is that it brings together the primary care physician. It brings together the surgeons, the administrators, the lawyers, the brokers, the insurance agents, and we all sit in a room and we talk about how we can work together, how we can help that customer get the most out of the money they're spending. And while I still do have some of those patients who come in off the street, who call my number and say, hey, I need help, I need you to give me a fair price, At the end of the day, my true customer is going to be those employers that are out there. Because the employers, I think it's something like 65% of companies with more than 200 employees are self-funded, and that number goes up to 85% of companies with more than 500 employees are self-funded. So my true customer is that employer who's footing that bill. And so we try to build up that relationship working with those employers and the administrators who administer those plans to help send those patients to the right place of care so they know that they're being taken care of and they're receiving high quality service. Which is going to segue nicely to Jay Kempton, who's going to talk to you about TPAs and employers and how they can best serve your patients. So thank you.